Hi, I'm Dr. Procter with Beltline Health, and today's topic is reflux after bariatric surgery. So this is one of those interesting issues. When I talk about reflux, there's two different ways to kind of break this down. Reflux is actually food, stomach acid, bile, those types of things that people actually feel coming up, maybe into the back of their mouth. They will wake up and say, I feel like I'm choking, feel I have a mouthful of stuff that has come up, versus heartburn, which is symptomatic of bile and stomach acid that gets into the esophagus and causes pain. People can have heartburn without reflux, they can have reflux without heartburn, they can have both. So we're going to encompass all those in one talk. So let's first talk about what causes reflux in a normal state, in somebody with a normal stomach. The esophagus is a long muscular tube. The bottom of the esophagus has an area of higher pressure that keeps things, allows things to go by, but supposedly keeps things from going back up the wrong way. Some people just have a weak muscle there and it allows things to reflux back up where it shouldn't be. Some people will have something called a hiatal hernia. It's a term you may have heard of, where the stomach actually pulls above the diaphragm. If the opening there in the diaphragm is too large, the stomach can over time pull up into the chest, distorting its normal anatomy and causing reflux symptoms. So in particular with an operation like a sleeve gastrectomy, where you're going from a very large normal stomach to a very narrow, tight stomach, eating or drinking just a little bit of stuff is going to create a lot of pressure inside that narrow stomach. At the bottom of your stomach, you have a muscle called the pylorus, which is a circular muscle that regulates how much stuff leaves the stomach and moves on downstream at one time. Now, if that muscle is very strong and very tight, and you have a full stomach and you have a weak lower esophageal sphincter, or you have a hiatal hernia that's allowing you to reflux, then people are going to start refluxing like crazy. So we will see a number of people who never had reflux in their lives develop reflux after a sleeve gastrectomy, and the question at that point is, what do we do about it? Traditionally, if a patient comes in and they have surgical reflux disease or something that we can surgically correct and they haven't had a sleeve, we can tighten the diaphragm around the esophagus so that the stomach is less likely to slide up there. We can also wrap the fundus of the stomach around itself, creating a large mass that makes it harder to get through that hole. Once a patient has had a sleeve gastrectomy, they have a very narrow stomach. At the time of surgery, it could be just barely wider than the esophagus itself. And so there is much more ample opportunity for that stomach to telescope back up through that small hole in the diaphragm. So recurrences of even hiatal hernia repairs after sleeve gastrectomy are pretty high. So a number of ways we can address this. We can go back and just fix the hiatal hernia again. We can try to tack the stomach down into the abdominal side of the cavity. These things work with variable degrees, but if this really is just an issue of having a weak lower esophageal sphincter, so things are going to reflux even with normal anatomy, a lot of times the gold standard of care there is just to convert your sleeve gastrectomy to a gastric bypass. That does a couple of things. It takes that pylorus muscle out of the flow of things, so we now have a man-made connection between the pouch and the small bowel, so things can flow a little bit more freely. It also takes away the route for the stomach acid and the bile to flow backwards up the esophagus, because with a gastric bypass anatomy, it would have to make a big roundabout to come up. So it is a very good anti-reflux operation, but unfortunately it isn't a 100% cure. So this may be an ongoing issue for a lot of patients, but it's one of those things that we're constantly talking about, constantly trying to work on to see how we can remedy. This has been our update on post-bariatric reflux. Please like and subscribe. If you'd like to make an appointment with our office, please feel free to give us a call, 470-419-4380.